Well, you're most welcome to this talk, Wednesday the 23rd of March. Now, you wouldn't think it being out and about in the UK today, but we have the highest prevalence that we have ever had any time in this pandemic. The number of people with COVID in the UK is at its highest it has ever been in terms of prevalence. Absolutely incredible. And we're just breaking records day by day. Let's just look at some of the graphics that don't show this. So here we have the United Kingdom here, and we can see that cases are up a bit. But of course, the cases are not reflecting the overall number of infections by any means. Cases have become a very small subset of the total number of infections. So I'm not quite sure why we still show this slide really, but there you go. It does show some interesting things. The States is genuinely down. Canada, we believe, is genuinely down. Hungary and Poland fairly low, but testing there is poor. But it's still interesting to look at it. New Zealand is increasing now. New Zealand is quite interesting. They've just announced that they're going to stop vaccine passes and some vaccine mandates in New Zealand. I've just got some notes of this here. So this New Zealand's just coming up to the realisation that Omicron might be quite useful for them, and they're stopping some of these vaccine mandates, but not till early April. I must say, I've been surprised that a liberal democracy like New Zealand, and indeed Australia, have been so draconian in their approaches to vaccines. Earlier on, a year ago, 14 months ago, I would have probably agreed with them. Times have changed, and governments and senior medical officers are remarkably slow to change for some reason I really don't understand. So that's going to stop from early April. So still a bit yet, because it's still only the 23rd of March. There's going to be stopping the limits on gatherings. The requirement to use COVID-19 tracker app when entering businesses will stop, probably also about the beginning of April. And just while we're looking at New Zealand, it's quite interesting. This guy's a modeller. Vaccines are still hugely effective at preventing severe illness. Yes, they are. And in Hong Kong, we're seeing the hospitalisations that go to demonstrate this. The basic course of vaccination is essential, particularly in the elderly groups. But of course, now we're in the Omicron era, when natural infection is taking over. The risk-benefit analysis has changed. But that's still true. It still gets a tick. But less effective at stopping people catching and spreading the virus. So we were told get vaccinated to protect those around you, and that is much less true than it was. Much less true than it was. The main reason to get vaccinated is to prevent yourself from getting severe illness, hospitalisation and death if you're unvaccinated. So it's very much about the individual now, which really I feel is the way it should have been all the way through. Medical intervention should be for the individual, not for those around us, or less so. At the same time, we now have increased levels of infection-acquired immunity in the population. Good, that's exactly true. And Michael Planck goes on to say, this means that allowing unvaccinated people into places like cafes and bars doesn't substantially alter the risk for catching COVID there, which is true. Which is absolutely true, because people that are vaccinated are still spreading the infection. So that's good. At least as many people will be infected on the way up, with the way down, as on the way up the mountain. So what he's saying is that cases have increased, and they're high, and I think they're going down a bit now. They're still fairly high, but when they go down, the numbers will still. So the numbers will still be quite high, and the numbers will still be quite high. So there's still a lot of people still to get infected, and that can carry on putting pressure on the healthcare system in New Zealand. So that is true. Keeping mask rules is critical to limiting transmission. Well, I'm not sure in the age of Omicron we have the evidence for this anymore. In the early days, with the wild type, the Wuhan variant and the Alpha variant and the Delta variant, this was true. But with the Omicron, especially the BA2, it's so transmissible. I'm not really sure we've got much evidence for that anymore. It could be true to a degree with the higher quality of masks. With the lower quality of masks, I think much less so. Anyway, let's carry on and look at some more of the data before I got distracted with that. So they were the cases as diagnosed by testing. Now the R rates This is the R rate of 1 here, and again, this is based on official testing, so we can't really say how accurate it is. But basically, you can read those countries, if you could see the screen. There we go. Those countries, that's the R equals 1, so these countries are increasing. Greece, France, United Kingdom, New Zealand, Australia. The ones below 1 are decreasing. So that is where we are. Denmark, of course, cases way down. And Denmark was the first country really to go through the Omicron wave, liberalising and in fact removing all restrictions really quite some time ago now. And it's shown in the level of community immunity that they have acquired as a result of that. There we go, Omicron everywhere. It's all Omicron now. Number of COVID-19 patients in hospital per million. So this is much more accurate data. Now, United States, I mean, really quite a big drop in hospitalizations in the United States, which is good. Australia slightly going up, then Canada, Israel, Netherlands, Poland, they've gone down quite a bit. They were quite high in Poland, I think. Denmark going down, United Kingdom, we're actually going up at the moment. Hungary going down, France kind of level. So that's roughly where we're at. So at the moment, the United Kingdom hospitalizations are going up. And we are going to look at this in a bit more detail, but perhaps 50% of these, in fact, maybe more than 50%, are incidental admissions because the prevalence is so high at the moment. People that are being admitted to hospital, there's a good chance they're going to be COVID positive, whether they're symptomatic for COVID or not, just because the prevalence is so incredibly high. It won't stay this way for very long because we're developing huge amounts of natural immunity. Is that? Yeah, there we go. New COVID deaths per million. So, well, Israel, Netherlands, Australia, Canada, deaths are fairly low, and these figures are accurate. United Kingdom, slight uptick. New Zealand, they're going up a bit, but remember, keep this in context. This is 2 per million people per day, so it's relatively low numbers. And the majority of these are dying from COVID, but some are dying with COVID. Poland, the United States has come down dramatically. Greece, Denmark coming down, as we say. Hungary going up, unfortunately, as they suffer their severe Omicron wave now against a background of somewhat reduced vaccination compared to other countries. I think that's all we've got on that one. So let's go back and have a look now. I'm going to look at some Office for National Statistics data today, which is pretty interesting. But let's just have a quick look at China, because I just can't make head nor tail of what's going on in China. They've had 4,770 new cases in the last 24 hours, claimed, probably right. City of Zhejiang, 9 million people, they had 47 cases. And as a result, the whole city is basically locked down, 9 million people. All housing compounds are under closed management, and we do mean that means closed management. That's really quite a dramatic lockdown. They're doing local lockdowns, they're doing mass testing, they're doing citywide closures, they're taking a pick and mix strategy. Dozens of officials have been punished and sacked for virus control failures. So if a virus outbreaks in an area, the local officials are punished. And I think this might be a good part of what's explaining the zero policy, because local officials are trying to close down the infection, thereby preventing community immunity from developing, so they don't get punished. This ludicrous zero COVID policy they're still trying to maintain. Is China going to become a hermit kingdom like North Korea? Clearly not. The two are remotely comparable. Therefore, it's going to be continually re-exposed to Omicron at the moment. Therefore, they can't keep it out. So quite what they're doing. The only thing this makes any sense with the China policy is if they are using this time to vaccinate the elderly. Because as we see here, only this figure here, only around half of the Chinese over 80 have been doubly vaccinated. So if they're using that time to vaccinate the elderly, it makes some kind of sense. If not, it doesn't, because you can't stop Omicron. Now, here's the Zoe data. Now, tragically, Tim Spector's group has lost its government funding inexplicably, because the data this group has provided throughout the pandemic has been quite superb, and it's always the most up-to-date data. And here's today's, and we see the prevalence is higher than it ever has been. Let's just look at the figures here. 3.6 million people currently infected, highest it's ever been. New daily cases 332,000, quite incredible, and the number of cases the highest it's ever been. And if we compare that to the UK summary here, we look at cases, even with the something went wrong. Let's try something else. So with the cases, what I wanted to show you there is the cases are indeed, there we go, it worked. The cases are indeed going up, but of course they're only a subset of the actual infections. But even then, we're still seeing some pretty dramatic increases, even with incomplete testing, with a very, very high prevalence that we are currently going through in the UK. But how's that transposing into healthcare? Patients admitted to hospital, well, it is going up. So admissions are higher. In the last month, they have definitely gone up. That was the Omicron wave there. Then they went down. Now admissions are going up. People, that's mechanically ventilated. Sorry, that's patients in hospital. This one here is admissions, and they're going up. So admissions are going up. Hospitalizations are going up. Now, the poorest people are not very minimal increase, but basically that's gone down since we started with the Omicron wave. Intensive care bed occupancy has gone down. Very slight uptick there due to the very high prevalence at the moment. But do remember that about half of these people are hospitalised with COVID-19 because of the very, very high prevalence rate. And here we see the deaths, and again this is pretty accurate data. So deaths in the United Kingdom within 28 days of a diagnosis going pretty well. I mean, obviously it's still a lot of deaths, but the direction is very good. It's going down quite dramatically. So the actual number there of deaths is the last 7 days, 887. And of the 887, remember about 25, maybe even 30% died with COVID as opposed to from COVID. So that's the UK sort of official data. Let's look at some Office for National Statistics data. Now, the Office for National Statistics data is incredibly accurate data, but it's also very expensive to collect. So it's a bit strange that Tim Spector's group's been taken out, but the very much more expensive ONS data has been retained. And the thing that the ONS data, while it's brilliant, what it is not showing us, it's not showing us data comparing infections and hospitalisation rates with people after the vaccination versus people with natural infection. Why, oh why, does it not show us this data? It's almost as if the government is trying to give the impressions that the only way to generate immunity is vaccination. Now, I'm not being as cynical as that, but why are they not giving us the data that compares infection rates and hospitalizations and deaths, comparing the vaccinated with the unvaccinated? And there are several million people in the UK that aren't vaccinated at all. So there is a data set there, but we're not allowed to know that. So that's a pity. But the data that we have is pretty good. So England, we see the cases actually going up, as we know, high percentages. Scotland, it's even higher. Now, if we look at their Scotland, so England, we've got at about 4.5%, 5%, pretty high. And this is from surveys, not from official testing. It's their own surveys. Scotland, about 7%. So Scotland has had more severe lockdowns than England, many more severe restrictions. Let's hope it's not for political reasons, but we won't talk about that now. But England has had more liberal restrictions. And what seems to have happened in England, the community herd immunity has developed more quickly, whereas in Scotland they've slowed it down, and now the rates are going up. But what the more severe restrictive measures like the mask wearing in Scotland, well, that's resulted in 7% prevalence, whereas in England we're now on 5% prevalence. So from this data you could say that enforcing mask wearing is temporarily correlated with the 2% increase in cases. Now, I'm not saying that's the case, but we know that correlation doesn't equal causality. But it does show that the Scottish strategy really hasn't been more effective than the English strategy by any means. England, now this is a BA2, which has clearly overtaken BA1 in blue, unambiguous. So BA2 now the most prevalent in England. I'm surprised it's taken as long. It took quite a long time, but you can see that line started off gradually and has got steeper. So that projection there is probably where we are now, with a more steeper increase. But the data's uncertain, whereas the BA1 has it will almost certainly has gone down, but the data can't show that definitively. Scotland again, BA2, much more prevalent than BA1. Now I've put this up because this is age 2 to age 6, and this is the older age groups in terms of prevalence. So this is prevalence for these different age groups. So we can see it is going up. The prevalence is going up in the younger age group, which isn't surprising. Going up fairly sharply, but it is going up in the 50 to 69, and it is going up in more slowly, but it is going up in the over 70s. And of course, it's these groupings that are ending up in hospital with COVID-related symptoms. Although we've said that half of the hospitalisations are roughly half are incidental at the moment. So that does explain the increased hospitalisations to some extent. And of course, remember that the average age of death from COVID in the UK is still 82.5 years of age. Now, this is long COVID. Now, this is the end of January. So we see an increase in the estimated number of people living in private households with self-reported long COVID. Now, the big weakness in this ONS data here is this is self-reported long COVID of any duration. So this is a pretty wide collection of possibilities. And this varies from people that are really quite debilitated with severe pathology after long COVID to those that just fancy a few extra weeks off work because it's self-reported. It really tells us very little. We need a more exacting way to know what the burden of long COVID is. But assuming that this is largely genuine, to the end of January we do see increases, but with long COVID there's a gap. So I'm just wondering how many of these long COVIDs are attributable to Delta infection. We don't really know the extent to which Omicron is causing long COVID at the moment. It's still a bit early to tell that. But this data collection, this is a weak data set because it's self-reporting. So we need to think of something more objective than subjective self-reporting. Now, these are the symptoms. These are the latest symptoms that they have. So cough, again, we see the percentage of people with it. So 40% of people have cough. That's gone down slightly. Headaches. And you can see the trend here. Sore throats become more common. Fatigue becomes slightly less common. Muscle aches. Fever, less common with Omicron, as we know. Shortness of breath, thankfully, much less common. Loss of taste, all of a sudden, seems to have become less common. Quite dramatically so. With the current interaction between the Omicron and the immunity that we currently have. Nausea and vomiting, loss of smell again way down, abdominal pain, diarrhea down, and no asymptomatic people roughly the same. So that just shows the type of symptoms that people are reporting on the ONS data. Hospital admissions, some children admitted largely for precautionary reasons. And of course, in the older age groups, much larger numbers being admitted to hospital. Now, I've put this on here because, of course, no 11-year-olds. Well, no. Some high-risk children are being vaccinated, but most children under the age of 12 are not being vaccinated. So that means that all of this 72.3%, or nearly all of it, because there'll be a few children with a higher risk that have been vaccinated there, but nearly all that is natural immunity. And of course, that's measured on antibodies of a particular level, and there'll be many children of that age group who've been exposed to the virus whose antibodies have waned below the detectable level. So we see levels of natural immunity fairly high in children. And from the data that we've been allowed to see from the United States, it shows that if people have had the natural infection and then they're vaccinated, they don't have additional protection against disease. If people have had the natural infection, then they've been vaccinated, they don't get increased protection against hospitalisation. Based on the data from New York and California, where the heck is the data from the other 48 states? Where the heck is the data from the UK on this? We're simply not given it. Pity. But from that, we can infer that, at least for that 72.3%, there would be no advantage, further advantage to vaccination if the data from New York and California is applicable here. It would be nice if we had a bit more data to be more definitive on that. Deaths, well, again, this shows the different waves really quite clearly, doesn't it? Much, much lower in the Omicron wave. Comorbidities in people that die. Diabetes is still the one to keep under control, isn't it? Respiratory diseases, high blood pressure, urinary system, ischemic heart disease, and the other comorbidities that are associated with people dying. But again, still a fair old chunk who don't have reported comorbidities on the death certificate. Hospital admissions involved with COVID-19 increased. Yep, we've got that one. Okay, so there we go. Good variety of data. Excellent as far as it goes. Frustrating in what it doesn't tell us, really. And just to finish off where we started, the ONS data in terms of prevalence, which is accurate, it's based on large-scale surveys. England, 1 in 20 people currently have it. That'll be the week. This will be the week ending the 14th of March, I think. So it's always a bit behind. But 1 in 20. Incredibly high prevalence, highest it's ever been. Wales, 1 in 25. Northern Ireland, 1 in 14. 1 in 14. Scotland, with their more restrictive interventions, 1 in 14. Much higher than England. Highest prevalence there's ever been. The prevalence in the United States will be going up shortly as BA2 starts to take over from BA1. Based on the UK data, it's looking like it's not going to cause a massive increase in intensive care admissions, but it can cause some increase in hospitalisations, but it will be temporary, because as we've seen in Denmark, the number of cases will go down quite dramatically as natural immunity is greatly enhanced by the Omicron variant. That's a quick update for today. Thank you for watching.